Good morning, dear friends. Today I would like to speak on herpes zoster. It's otherwise known as shingles. It is nothing but a viral infection which affects the skin, especially the skin, in a dermatomal fashion. It means that it affects in a particular direction, like one particular nerve or root. So it comes like this in a particular way, something like a dermatome. This affects the chest, the head, the neck, the lumbar region, the sacral region, the limbs in a particular fashion. So this doesn't cross the midline. It is caused by a virus called zoster virus or varicella zoster virus. Usually the first infection would result in chicken pox, and usually what happens that after some time, due to some factors like immunosuppression, diabetes, hypertension, HIV, AIDS, those who are using chemotherapeutic agents, those who are undergoing radiation therapy or some other stressful factors, leukemia, lymphoma, and like things like that. This would result in a reactivation of the virus which are present in the dorsal root ganglia or in the cranial ganglia, which would transmit, which spread in a retrograde fashion to the nerves, in the particular nerves, in a dermatomal fashion, and would result in a vesicle formation, pustule formation, and finally crusting. This would start with pain, burning sensation in that particular nerve distribution initially for 2 to 4 days, and result in further development of vesicle rashes and crustaceans, and this would heal in a period of 2 to 4 weeks. This is the usual usual history. The incidence of this condition is, it's said that 1 million people in US, in the America, develop this herpes zoster every year. That means around 15% of the population. In India, it might be around maybe half crore people every year. Maybe around same 15% of the population means it's a huge number. It's a huge number is affected every year. So usually it's a benign condition, usually, but sometimes this can result in various other complications. This can affect the brain, it can affect the nerves, it can affect the spinal cord, this can affect the blood vessels, the eyes, the hearing, every part can get affected, excluding the skin. The skin infection would be a rashes in a particular distribution called a dermatomal distribution. And if it's affect the brain, you call it as a meningitis, meningoencephalitis. This can result in the damage to the vessels, the arteries or the veins, and can result in the stroke, ischemic stroke, both hemorrhage. I have seen patients with hemorrhages, with the brain bleed, as well as with ischemic infarct or frank MCA, middle subartery ischemia, occlusion followed by a infarction. Okay, this can result in the myelitis or the involvement of the spinal cord. This can involve the lungs as well as the other organs. This can involve the eyes, causing blindness or any scarring of the cornea. This can involve the face, causing a facial weakness. This can involve the ears, the nerves, auditory nerves, something called a Ramsay-Hunt syndrome, and can result in deafness, vertigo, and facial weakness. And this can also give rise to various some called radiculopathy, means multiple nerve roots getting affected, causing a weakness of a hand, or a plexus lesion, a demyelination of the plexus, something called a brachial plexus or a lumbar plexus, causing lumbar plexitis or brachial plexitis. So many manifestations of this particular condition have been found. So as I mentioned, this usually present in this way, and for some people, around 20% of those who are affected by this herpes zoster can develop one condition called post herpes zoster neuralgia. It is exquisitely painful condition, usually occurring in people over the age of 60 years, especially females. They would come with burning pain, dysesthesia, paresthesia, itching, and all sort of sensory symptoms, and would this will be a continuous process, and they would run from pillar to post, and the treatment may not be effective, but there are treatment. I'll come to that after some time. Okay, so this is very common in the population, as I mentioned, especially those who are immunocompromised, and usually this won't cross the midline. This will come from one back to the center of the chest, or from one part to this thing. It won't come to the opposite side. Rarely this can spread to the different areas called disseminated herpes zoster, or usually it's a one line only, but sometimes it can be 1, 2 or 3. It's called atypical form. Okay. So, this can be prevented by a vaccine called Zostavax vaccine, which has found that especially in people who are over the age of 50 years, this would result in less number of cases, the 70% efficacy and the decreased incidence of the post herpes zoster neuralgias. So, how do you diagnose this? Diagnosis is mainly clinical. You observe the patient, look for the rashes, and you can always take a fluid from that lesion or the vesicle and can send for a PCR testing or a viral cultures and other studies. This would be positive, but usually we don't do that because it's largely a clinical diagnosis. But there are certain conditions which would present something like that, something like a chemical dermatitis or a contact dermatitis or some form of a zostriform herpes simplex virus, and rarely I have seen a case with a syringomyelia presenting in a itchy lesion in a dermatomal fashion. This can occur, but these are extremely rare. So, as I mentioned earlier, there are many complications for this thing, but luckily these are quite rare, and the treatment would be it can be usually oral medication like famciclovir, valacyclovir or acyclovir. But if this affects, if there is a disseminated infection or it's a atypical form, or if there is a herpes zoster ophthalmicus, or if there are plexitis or radiculitis, or if it's a meningitis, meningomyelitis or myelitis or encephalitis, or some form of immunocompromised patients, in those people you can use an intravenous medication and always supply with a short course steroids and some simple pain medication. And the treatment for herpes zoster neuralgia, it is slightly difficult because none of this medication which we use in other neuralgic condition like carbazepine, oxcarbazepine, gabapentin, pregabalin, lamotrigine, nothing would work here. The only drug known to affect or improve the pain is tricyclics, and maybe you can use capsaicin cream or local cream or the gabapentin local cream, but tricyclics is the key. Okay, right. So you have to hunt for any secondary cause like some immunocompromised state like diabetes or malignancies. If there are on steroids, you better curtail or reduce the dose of steroids, or maybe you can halt for some time unless it is indicated in that particular condition, or in immunocompromised drugs used for immunocompromised state, you may have to withhold for some time. And you shouldn't use this this vaccine in pregnant people because it's a live virus. And if the patient is having this herpes zoster, you should always keep away from pregnant people, from small kids and infants, or those who are immunocompromised. That means those who are on steroids, chemotherapeutics, those who are undergoing radiation therapy, those with the HIV or AIDS or malignancy. You should always keep away because they would develop something called a disseminated herpes zoster infection or atypical form, which would result in different form like a lung involvement, brain involvement, spine involvement, meningeal involvement, and many complications related to the disseminated zoster infection. So I would like to conclude here by telling you that herpes zoster is a common condition. This is nothing but a younger son of a chicken pox, because the initial infection would be a chicken pox. After some time, when they reactivate, when the virus gets reactivated in the ganglia, in the dorsal root ganglia, this would go in a spread to a particular dermatomal fashion that's called as a herpes zoster. So I hope I could give you a bird's eye view on this particular condition of herpes zoster or shingles. And if you have any queries or comments or opinion, you are always welcome. Thank you very much.